So I just found. All right, so we'll get started. We're gonna talk about our selected sites and just some guidance around some things that we've been learning over the last few visits with some of our programs. So today we'll continue to dive into some lessons learned and some tips as you're moving forward, and hopefully trying to give you all that haven't gone yet an opportunity to kind of double check things or be prepared, preparing your staff, advisory board, so on and so forth. So again, today's agenda we'll talk about what supports are available to you all as you're preparing either for the submission of your self-study, or you're preparing for the peers to come on site. There's a number of things that we have posted to the HFNY website under the accreditation tab. Different 101 series that have supportive materials. All of the PowerPoints are on the website. So we'll go through some of that. Just a couple of important reminders, similar to what we talked about a couple weeks ago, but just making sure that folks, if anyone's missed last time, just some important reminders. Feedback from HFA on sites that completed visits. So just pulling some information on some of the debriefing that we've been doing with HFA on some things that have been standing out. So again, that you can have a heads up on some things to maybe pay a little bit closer attention to. Tips for when peers are on site. So just some things to think about or some advice when they are on site. And then just a quick follow-up on what happens after peers are on site. So what does that response period look like? And we're not going to dive deep into that. I'm going to share a link to the presentation that we did where we talked through the response period. And then I figured next time, because there's a lot in today's slides, so next time we can look at the response period again, but I did share a specific link where you could take a look at that for those that want to get some more information on what the response period will look like after your visit. So some of the supports that we've been doing monthly webinars to share information and answer questions. Like I said, all of those are posted on the HFNY website up until February of 2024. For a year, we did 101, Accreditation 101 with all sites. So that's a separate tab under accreditation. You'll find everything prior to when the 15 sites were selected. There's, like I said, PowerPoints. All of those or most of those sessions have been recorded and posted on the website, as well as additional materials or resources under each of those for the topics we discussed. And then beginning in March of 2024, we held these sessions for the 15 sites that were selected. Those are also all on the website, all recorded. PowerPoints are there, and then any resources that we provided. If you have questions or you're not understanding something, please reach out. I would be happy to do like a one-on-one call with anyone who's feeling like they need some support around something, or if you're feeling like it's confusing to try to go through all of, because it's a year and a half worth of videos and calls and materials. So I'm happy to talk to anyone who feels like they might need kind of narrowing down where they can find things or walk through something. For those who are getting ready or will be submitting your self-study, if you haven't done so already, you did receive an updated data chart that had individualized information for pulling your MIS reports. Those went out in March of 2024 in an email. If you don't have that, you're not sure where to find it, your program contract manager was CC'd on that email, so they could help you locate that if you need that when you're pulling together your self-study. Also on our website, there's the accreditation tool that we updated that helps you walk through what needs to be included for the self-study standard by standard. So that's good to reference when you're completing your self-study. There's also an accreditation prep guide from HFA that we pulled some things from and did some presentations. In one of these sessions with just the 15 sites, I think it was April, we went through what like some topics that will be part of interviews. So for those that are preparing for their on-site review, you might want to take a look at that April 8th PowerPoint presentation, because there's sample interview questions for each of the folks that will be interviewed, as well as a list of standards or topics that could potentially come up. And then just so that as you're preparing your staff, you have some ideas around what are some things you may want them to kind of think through. So again, I think that was around April 8th, we went through that. Making sure that the PCMs have enough time to review your final self-study to ensure that all elements are included. So if you have a due date, for the uploading of your self-study to the HFA SharePoint, you're completing it first in the OCFS SharePoint, but giving, like a 2-week window to have your program contract manager take a look to go through that. We've provided them with a tool that they can use to go through your self-study to make sure that each of the elements are included there. And then once you go through your visit, if there's anything that you need to respond to, OCFS, program contract managers, as well as the Prevent Child Abuse New York team, and even if needed, CHSR, more than happy to help review documentation and give you feedback on anything that you might be questioning. Okay, so important reminders. So making sure, we talked about this last time, that you know when your self-study is due. So if you don't know when it's due, you should reach out to your program contract manager to make sure you have that date. The peers are usually asking for it, in some cases, 6 weeks prior to your on-site visit. Although for some, it was, you had the due date, but then you didn't get the confirmation letter, and maybe they said, okay, here's the link and it's due on Monday, on Friday afternoon. So the expectation is that it's done 6 weeks prior to when the on-site review is. Like, don't wait to get that link, because it may put you in a situation where you were kind of waiting for the link to, finish up your self-study. But, the expectation is that that really is done and ready to go 6 weeks prior. And again, if you don't know when that is, you should reach out to your program contract manager, because they have the dates for all of that. And then if, you get that link, it's not, your self-study isn't due, just know that delaying the submission of that closes that window and opportunity to be able to submit additional evidence. So peers ask for it 6 weeks in advance so they can go through, they can communicate anything that they might not be seeing. So if we're giving them less time to review that, it could mean that there might not be that opportunity for them to follow up with you to ask additional, additional questions or gather additional feedback from you, or not feedback, but additional evidence and additional materials. If you have a later on self-study due, so if you're somebody that is going to be visited in September, you can start putting your self-study together. You can, move your policies into the appropriate folders. You could take a look at your narratives for your ASR. Those can be copied and pasted into those separate documents and uploaded into the corresponding folder. Your equity plan and CQI can be put into the appropriate folders. All of your staffing information for the 9s can be put into those corresponding folders. Again, so use that accreditation tool that'll guide you on what you need to put where in SharePoint. Use your data checklist to help you with your data reports. And then make sure you're giving your PCMs time to review your finalized self-study to be sure everything's where it needs to be before you upload it into HFA SharePoint. Once something is uploaded into the HFA SharePoint, it can't be deleted. So we want to make sure whatever's going in there, it's good to go. And you can do additional things. It's just you're not going to be able to delete anything once it's uploaded. And then as a reminder, the peer reviewer access to the MIS. So as soon as you get your peer assignments, you should put a ticket into the MIS with the peer's name, their email addresses, and the dates they will be on site. And then CHSR will grant them access for the period that they're on site. You will need to do some TA with your peer reviewers on how to navigate the MIS. So, plan on that the first day, whether that's a Sunday start date for you or a Monday start date for you, that you have some time set aside to walk through where they're going to be able to find information. So it could even be, having somebody at your site, or if, somebody that might have time, maybe do some sort of like, letting them know where they're going to find things. So if they're looking for information on shears, you're going to want to let them know, maybe a key to say the home visit log covers these topics, the supervision, form covers these topics, just so that if they're looking for things, they know where in the MIS to go. Okay, so we're going to jump into some of the feedback that we got on some of the visits that have happened over the last several weeks. So looking at best practice standard number 2 for 21D, supervision notes for supervision of frog. So, ensuring that the supervision notes show that there's discussion and support for each frog that has been administered. So they are going to look at the supervision notes to make sure that the supervisor is providing that feedback, that support, that discussion for each and every one of the frogs that are administered. So they're going to want to see the documentation of that in there, that there was discussion around that. Transition plans. So one of the things that came up was around planned closures. So when there is a planned closure, are you creating transition plans? So making sure that you're reviewing your policy with supervisors and staff to be sure that there's clarity on when to create transition plans. And that if a family is declining a transition plan, that you're also documenting that on the transition plan. So you need the date of when, you had that discussion and they declined the transition plan, and just like something in the transition plan to say that they did decline that. And so we have the transition plan as part of the MIS. So just making sure if you know that families, you have that 3 months, or maybe and you're able to, do some transitioning with the family, but definitely for those planned closures, if there's that time period, that you are creating the transition plans for families. Or documenting, if they're declining, but you've offered referrals for them, or some sort of resource that even if they declined the transition plan, that you're documenting that, yep, they declined the plan, we provide, on this date, and we provided them just some resources. So making sure that, again, they are going to look for those transition plans. That's something that has come up more than once. Lots on best practice standard 5. So we're going to spend some time today talking about some stuff within standard 5. So this has been somewhat of a theme, not just within our system, but even nationally. It's new, and some of it can be confusing or feel, unfamiliar to folks. So I wanted to spend some time just walking through a couple things. So the first one, 5.1A and B, your team agreements or commitments, and that policy. There is absolutely going to be interview questions on team agreements. So do you have them? Does staff know about the team agreements? Do they know their policy related to 5.1B? And are they able to describe it? And so some of the tips around this were things like, if you have team agreements, making sure that all staff have a copy of that. Maybe you want to post them around the office, or if you have a specific meeting room that you do staff meetings, maybe that's where you want to post them, so that staff are aware of what they are. They remember that you have team agreements, that you're reviewing that policy with them. So making sure that it is visible, they're aware of it, because there's 100% they're going to ask questions around the team agreements or commitments and that policy. So review that. Um, and then engaging families in partnership and raising family voice and honoring diversity. So 5.2b. So again, are staff aware of the policy around engaging families in partnership and elevating voice? Can they give examples of how they do this? So, we talked a little bit about this in some of the other 101s back in, I know, it feels like forever, right? We did 3 different, we did 2 101s and one of these that talked about standard 5. And so I would, in the policy, itself, there are some links to different resources that you can look at around or around standard 5. So I would take a look at what is available there. There's also resources on our website. But here, one of the 101s that we talked about is these are things that you're doing. It's just being able to help staff identify what that looks like, right? So how do they use those reflective conversations and within their practices to learn about a family's unique culture? And then how do they put what they learn about families into practice? So, for example, going out and just asking questions about the family's culture, respecting that when you're going to the home, simple things like that is raising families' voice, because you're taking that into consideration when you're planning your visits, knowing is there certain times or certain days that families, can't, don't want to be visited for, maybe it's religious, maybe it's cultural, but taking those things into consideration when you're planning the visits, right? Also, do families help plan their visits? Do you talk to families about what are they interested in learning about, right? What materials are you bringing out when you're having those discussions with families? How are you planning that to make sure whatever they're sharing with you about what they want to learn about, how are you taking those things into consideration when you're doing your visits? Again, it's things that they're doing already. It's just trying to articulate that to the home visitors so that they can be like, oh yeah, we asked that, or, this is the feedback we got from the family. Somebody shared, one of the programs shared that, they were holding a family event and learned that a family could not participate in the food that was provided there because of cultural reasons. So the program, in preparing for that visit, gave the family a gift card to be able to purchase food to bring to the event, to keep that in mind, that they're not able to participate, like they wanted them to participate. They knew that the food there, they had to have different food. So in planning for that event, making sure that the family was involved, they honored that, and they were able to give the family a gift card so that they could still participate and bring the food that they would be able to eat. So just thinking through some of that stuff, maybe, in preparation in your staff meeting, talking about some of the things that you've done within your program to support families and honoring their diversity in your practices and your conversations with families. 5.3b, site leadership and community advisory board are aware of policies and written guidance and can describe efforts undertaken at the community level to identify and address existing barriers. So they are going to ask you as the program manager, maybe your supervisor, definitely your community advisory board, about this. And so you're going to want to review your policy, your advisory board minutes. You're going to want to prep with your advisory board members prior to your on-site visit to ensure that they're prepared to share, that they are, aware of the policies. They don't need to know in detail, but just to have an idea of the policies surrounding, the 5.3a. So just making sure that whoever is going to be participating in those interviews, is refreshed on what those policies are. And we're talking about what efforts have been taken at the community level to identify and address barriers. I've included some examples here. So, a community event to make services more accessible. So things like, I mean, I said community event, but even things like, did they hold a community event? Maybe there was like, a health event where they, if let's say dental care was something that isn't accessible to families in the community. So maybe they did something during an event to be able to bring that to the families within their community, not, having families have to go outside. Thinking about mobile services. So I know in parts of the western part of the state, they have, I think it's Help Me Grow, um, the mobile services for, I think they do like developmental screenings, they do eye exams, they do, maybe they even do some dental, exams there as well. But those are some things, again, like it's a rural area. So bringing the mobile services, those are some things that the community is doing, to be able to help address some barriers that exist within that particular area or community. Are there task forces within the community that discuss and come up with ideas to address barriers, right? So what are those? What's happening within your community? I know some of our programs are working on things related to health equity and what that looks like in their community, and have some things that they're working on, particularly, surrounding that for their community. Has the advisory board talked about barriers at meetings? Has anyone brought that forward to you? If so, if that's been part of the discussions at the advisory board, share that. Share, what those things are that are happening, whether your program is involved in that or it's things that are happening within the community. So kind of prepping for some of that, like what your program is doing, or I'm sorry, what is happening within the community to be able to address barriers. Lots of us know that many places are faced with housing challenges. So have there been things put into place in your area to address some of the challenges with housing? So just kind of thinking through some of those things and having those discussions with your advisory board members will be helpful in prepping them. So again, really making sure that staff, that your advisory board are aware of the policies, that you're, that you have those team agreements, your staff are aware of that they've, you've gone over policies with them. So that way during interviews, it's, people are prepared to be able to, and they're clear on what is being asked. Okay, so the equity plan feedback from staff and families. So is your equity plan based on the feedback from your staff and families? So one of the things is that they're going to look to see the strategies that you developed. Who, like, did staff and families, like, were they developed based on that? Everyone does surveys every year. So what are you learning from the surveys within your community that are feeding, or within your program that are feeding your equity plan? So, I gave an example here. You have feedback from families that there are not sufficient materials available in the language they read in. So maybe your equity plan is that you learn from families that this was a challenge for them. And so your plan is to work on obtaining materials in additional languages that represent the families you serve. That's just one example. So, looking at your equity plan, what was the feedback your staff gave? What was the feedback that you got from families, and making sure that that is clear within the equity plan. Review of the equity plan. So for a 2 rating, you must have review and feedback from staff. So once the equity plan is developed, you're going to want to review that with staff and get their feedback. There's a place within the equity plan that talks about the feedback, so you're going to want to include it in there. For a 3, it would be reviewed by both staff and the advisory board. So in New York, we require you to bring your ASR and equity plan to your advisory board meeting. So you should be able to talk through and provide an update on what the feedback was from the advisory board. I know sometimes there's challenges around even getting feedback from advisory boards when you're sharing information, but just, you know, being able to write in there that you did share it, what the feedback was from the advisory board. So again, for 2 at minimum, you will have had to review it with staff and then update it to show what that feedback was for 3 staff and advisory boards. And then I said, if you haven't reviewed and received feedback from your staff, do it now. You know, even for those that might be visited up until they're on site, you can update things. So if you take a look and between now and before they come to your site, you can update that you've reviewed it and give a little update on what that feedback was and resubmit it, you know, with that equity plan review section updated. So there are a number of BPS supportive materials that we've posted to the website. So again, there's links in the policy that have examples of team commitments. There's other links within the policy that bring you to other materials from HFA. I think there's some sample surveys that are included in there. So take a look at what those links are. There was Accreditation 101 from April 5th, 2023 and May 3rd, 2023 that talk about best practice standard 5. Again, give some resources, kind of talk through some things. So those 2 sessions, we went over best practice standard 5. And then the support for selected sites on March 11th, 2024, we talked some more about best practice standard, standard 5. And then in the April 8th, I'm not sure if the sample interview questions that were in that, I didn't go back into it, but there is a list for each of the roles and best practice standard 5 is on all of them. So program manager, advisory board, staff, supervisors will all be asked about best practice standard 5. And so in that PowerPoint, we talk about that being one of the topics that is going to be discussed during interviews. So take a look, that's the April 8th one where we also talk about the response period. Best practice standard 6 on service plans. So do you have service plans for all of your families? You know, making sure that those are in the MIS. We have the service plans in there so that everyone has one, that when you're doing service plans that you're prioritizing, we have the priority box that gets checked, making sure that they're checked, right? And if there's a challenge, which we'll talk about in a little bit, with if you're getting some sort of message that the peers aren't finding what they need, again, making sure they know where they need to find things. So referencing that there is the checkbox, that is how you prioritize, but that somehow you're letting them know in the documentation that you're prioritizing those risks that are coming up, making sure that's clear. And then after development of the initial service plan are the subsequent risks being added if applicable. So, you know, lots of times things might come up with a family, you know, after that initial frog. So are you adding any of those things to the service plan? Because they're going to look to see if during the course of services, and so you can refer to 6.1b, but during the course of services, not just during the frog, but what else is happening with the family? If something comes up during home visits and it's, you know, a risk, that you are making sure that you're adding those things to the service plan to be addressed. And then for 6.1c, how you're documenting activities implemented. So in the service plan, is there enough detail about what was implemented? So are you putting enough in there so that they can see what is actually happening? If you're referencing the details of the activities implemented. So in other words, if you're capturing the detail within a home visit log, And you're going to reference that in the service plan, that you're really clear on where they're going to find that information. So it may need to say, see home visit log dated, whatever. And if where you're going to talk about is under parent-child interaction tab, that you say that, curriculum shared on this, see home visit log dated, blah, 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 under parent-child interaction tab, so that they can read the documentation on that the activity was actually implemented. Or it's in the service plan, outlined there, but somewhere where they're going to be able to be really clear that you're implementing those activities based on what your plan was. More on 6, so family goal plans. Do all families have a family goal plan that are eligible to have one? So checking to make sure that that's happening. Another big one that came up was around how we're celebrating family success. So during interviews, can home visitors talk about what they do to celebrate family success? One of the things that HFA shared, it can be as simple as a high five, like just being able for the home visitors to articulate when a family completes a goal. How do they celebrate that with the family? What do you do at your site, right? So do home visitors know what that should look like? And is it documented somewhere, even something simple in the home visit log, to when they do complete that it was celebrated, just something consistent across home visitors, so that they know that this is something that is done with the families. And then our supervisors documenting the review of family goal in progress. So is that something that's coming up in the supervision notes? Making sure that there's documentation around how the supervisors are doing that with the home visitors. Cheers. So all families have observation of PCI. So making sure that you review that policy 63A and what the expectations of cheers documentation. So we used to, if the child was sleeping, you would just write that the child was sleeping, no longer, right? So since that policy was updated, even if the baby is sleeping, there still can be documentation of cheers on parent report. So making sure that you're reviewing that, checking the cheers on, the observation of PCI, and that that's being completed. So reviewing that policy. 6.3E, how are supervisors supporting staff with assessing PCI, addressing concerns, promoting the strengths of PCI within families, being documented. So again, we've talked about this. This is on your site visits with your PCMs, but how are supervisors supporting staff in cheers, right? So not just reiterating what was on the home visit log, right? Like stating what was already documented by the home visitor, but more around how is the supervisor, what questions are they asking, what are they talking about in order to support that staff with their assessing and addressing of cheers. And you can reference like the cheers handbook on the TOL. There's a ton of materials related to cheers. If you have questions, on what should be happening with supervisors and their support of staff, again, there's lots of supportive material. You can even talk with your PCANI QA specialist to kind of maybe even review some of those notes if it's something that you're concerned about. They can help you with that. This is a tricky one. So the postnatal depression screen. So if you look at the scoring in the best practice standards, you'll see that for a 3, 95% have a screen within 3 months of birth or 3 months of enrollment, whichever comes first. I was just shortening what it actually says, but for a 2, 80 to 94% have that screen within 3 months. For a 1, it's less than 80% or less than 100% within 6 months. So even if a family is beyond that 3-month mark, they still must be screened by 6 months to score in. So even if you're at 95% that are scored within 3 months, but you have a family that wasn't ever screened or was screened after 6 months, it's going to be a 1. So you want to watch that report to see, if you're within the 95%, 80 to 94%, what do the rest of those families look like? Because if anyone is outside of that 6 months, that is a 1. You'll see within the standard, and I think our policy too talks about this as well. So everyone needs to have the screen by 6 months. That's like kind of the first thing. And then for 80 to 94% have it within 3 months. And then for 95% of those have it within 3 months, but everyone within 6 months. So taking a look at that report and seeing what you look like for that. Okay. So peers on site. So this is a little tricky, right? So it probably will depend on the peers that you get, but if on the debriefing, if peers are saying they're not finding something yet, something is missing, what this should say is ask about it. Make sure you're clear on what they're looking for so that you can gather additional documentation prior to them leaving. So if you're getting feedback on something, make sure that you're clear on what it is they're looking for, because you can give them additional documentation to help them find what they're looking for while they're there. Once they leave the site, they will not accept additional documentation. Policies, it's like once they're done with the self-study, that's it. There really isn't much of an opportunity to update policies, but in terms of documentation, so if they're mentioning that they're not seeing where you prioritize things on the service plan, go back, make sure that they see that that priority box is there, that that's what gets checked. If they're not seeing something in supervision notes, look through the supervision notes, see if you can find what it is that they're missing. They are new to looking at the MIS, so I feel like some of it is a little bit of challenge navigating the MIS and being able to, find what it is they're looking for. So don't be afraid to ask questions and get clarity. So that way, if there are things that you can show them, submit to them, hopefully it will help with them get what they need, prior to them leaving. When you hear at the pre-exit needing improvement, it means that the site scored a 1. So when they're saying you need improvement, it's not because it's, a 2 or they think it could be strengthened. When they're giving you that information at the pre-exit, it means you scored out on that one. And so, you could still ask questions about that. If there's something that you can ask to submit before they leave, but when they say needing improvement, it means that you scored out on that one. And that peers are general at the pre-exit because nothing is final until the report is reviewed by HFA staff for final approval. So, it's tricky because they aren't super specific. Like if they're saying you need improvement on documentation of, I don't know, the supervisor supporting cheers, they might not give you like, well, what does that mean? What are we missing? Like it is going to be general. They're not gonna give a whole lot of information because again, it has to be reviewed before they can say that you're actually out on something. They won't give you like, yep, this is why, because it gets reviewed. But that's why it's important, like leading up to that, to be asking questions, getting clarity, make sure that if there are things that you think that you can provide to them, that you're doing that, prior to them leaving. So then the response period, we'll revisit the different HFA responses in the next session, but also referring, I put the link in the PowerPoint, we'll post this on the website like with the rest of them, but there are slides that break down each of the different responses. So, there's no response, there's the essential response that goes to HFA, and there's the panel response. And so each kind of like has a different threshold. And so the PowerPoint from April 8th walks through each of those responses and what it means for like what the scenarios are when you need to respond to each one of those things. So again, to national office and then to panel. And just to be clear, like when we say go to panel, you're not going anywhere. It's just you're submitting whatever documentation it is that you need to bring up to bring you up to whatever the threshold is that you need to be at in order to consider reaccreditation, if that makes sense. If you take a look at that PowerPoint presentation, again, it's detailed, it breaks it down on what those different scenarios are and what it means. There's sample forms in there for each of the responses. So there's a specific form that you would complete if you're doing an HFA essential response. There's a form that needs to be completed for that panel response. So those are in that PowerPoint presentation. Again, there's samples of those as well. So if you're, anxious to kind of see what those scenarios are, get some more information, it's on that April 8th session, and we can revisit that too in the next session. I just wasn't sure how much time we would have today to go through that. So what questions do people have?
Hey, I have a question.
Sorry.
Go ahead.
Go ahead.
You sure? Okay. So, I've already uploaded my equity plan into my self-study and sent it to the reviewers, right? So now that you've talked about that a little more today, I feel like maybe I should add a little more to that. I have a team meeting tomorrow, so I can review it with the team. I know how to do all of that. Do I re-upload an updated version of the equity plan or wait for them to get here and ask?
Upload it and then just shoot them an email to say that you had updates to the equity plan that you wanted to share with them.
Okay.
Yeah.
All right. Thank you.
I think the sooner the better, Wendy, like put it
Yep.
in here before they get on site.
You got it. Yep.
I have a question in relation to BPS 5. So in terms of like the families, interviewing the families and also interviewing the advisory board members, when will they let us know like do you have any idea of the minimum number of families or minimum number of advisory board members that they need to interview? Because I need to get
Yeah, so
my volunteers.
oh, we did talk about this. I want to say 10, but I don't know. Chrissy, how many I'm going to put you on the spot, or somebody who submitted their list. How many was it 10? Is that what they asked for?
We did 8.
8.
We did
Okay.
8 families and 2 advisory board, and they, our reviewers were really good, saying that they go with a big number in hopes just to have a couple families. So if you do have a couple families that, end up not showing up, at least our reviewers were really good, because we did have one family that wasn't able to make it, but I believe we started with 8 families and then 2 advisory board members.
Okay, thank you. Because we've been asking families already. So we have some who said yes, they'll do the interviews, but I just wanted to know the minimum. Okay, thank you.
I was wondering if we found out if there will be a specific set of interview questions or topics for assistant program managers.
Oh, I did not. I'll ask that. Sorry. That's a good question.
That's okay.
Sorry. I'll put that. So assistant PM. And that person supervises the supervisors?
Yes, that's correct.
Okay, I'll send that now and then I can reply. Sorry about that, Sarah. I know you asked. What else? Also, those are getting ready to upload. You know, I know a couple people have reached out with assistance for that. So if you're having trouble uploading your self-study, reach out to us. The last session that we did 2 weeks ago, I think it was, right? Was it 2 weeks ago? The end of June, I think we did one, the 26th. We talked about uploading your self-study, but if you need help with that, let us know. We can walk you through that again. And again, like if somebody, you know, you're feeling like you have questions about something specific, I'm happy to find a time to meet to go through anything that you may need support on yourself.
Do you know if the HFA meeting that was on, I think, the 9th last week about the accreditation site visit, I couldn't find that on the website. And I wondered if anybody went and found it helpful.
I think John Lindor got into that meeting.
I
John,
was there as well.
oh,
I
you
was
were
also there, yeah.
Yes. Mhm.
You were there, Rosanna, you said?
Yes.
Oh, okay. It should be recorded. It'll be on the network resources. I'll try to find that link and I can send it out to you all too if you wanted to listen to their presentation. I'll try to find that.
Yeah. I don't need want to be a negative, Nelly, but I mean, and this is just me, but I didn't really find it helpful because the two programs who were highlighted, their experience was very different because they talked about doing the self-study a year ahead of time, having the accreditation date a year ahead of time. So I felt like it was, at least for me, that's how I felt. One program was from California and the other from Nebraska, but I felt that their experience was very different from our experience. So I don't know if the other people who on the call felt the same, but I didn't find it to be particularly helpful.
The call you didn't find to be helpful, like how?
Because what they focused on, again, like they talked about this getting TA from HFA a year prior to the visit. So the experience is not at all like our experience, I feel. But that's
I-
just my. Mhm.
I agree with you, Demalia, because I think it was more towards non-multi-system sites. So I think it was very much geared towards single sites that HFA directly works with. So when they were talking about prepping a year in advance, that would have been kind of what they did for us at CA. So I think to your point exactly, it was very much for single sites, not multi-system sites.
And it's kind of like how, right? Like last year we started putting together the individual, like yours was a little different because we did the folders with the ASR, the quarterlies, like in preparation for HFA to come to the central administration review those. They reviewed your self-study initially back in February or prior to February when we submitted it. It was part of our self-study, and that's what helped them decide which sites they were going to go to. So you're right, it is different when it's a single site versus when it's a multi-site. There's more layers, right? So they come to us first, they select those individual sites, then they go to you, but yeah, so it is a little bit different. Like you don't, like your prep comes from your central administration versus when you're a single site and you're working with somebody directly with HFA. And they don't obviously have the central administration piece so that they're not visiting a central administration, they're going right to that particular site. But it doesn't look like it's been posted yet. So I'll keep looking and I can, or ask when that'll be available. And then send that out just in case for those that wanted to listen in. But that's good feedback, actually, like to share that it felt like it was good for single sites, but not so helpful for those who are part of a multi-site system. So anything else?
I'm just thinking for the interviews for staff, we've been doing a lot of kind of prep in team meetings, just talking about our policies and updates on all of the topics listed. Do we have a sample of interview style questions that we could run through a mock, you know?
Yeah.
and-
In that PowerPoint, I think they gave 2 sample questions. I pulled that from the guide. I can take a look to see if we have anything from the peer review training for those that took the latest one. I can see if there's anything from that I could share. Anything more specific on interview questions.
Okay, that'd be helpful.
Mhm.
Thank you.
Right, so, take a look at I'll post the recording for today, the PowerPoint, so take a look at those resources that we talked about. Again, please reach out if there's any specific questions you have or want to walk through or talk about anything. Just as a reminder, we are, trying to track our peer review, the peer reviewers. We have some that are going to more than one site. So we're trying to look at, Sally went to this site. This is what, came out of that site. She's also going to this site. So let's talk about what that person found at the first site. So we're trying to do some of that. We've only gotten 2 site visit reports so far. So it's a little hard because we don't have a whole lot of data yet on like the final kind of report out. So as we move along, we'll do that and share, we'll share that information across the board. But then also if you're somebody that might have a repeat peer reviewer, maybe just have some conversations around what were some things that seemed to be that they were interested in, just so that you have a heads up on that. But again, it's tricky because now it's going like one right after another and they don't submit that site visit report. It's like 4 to 6 weeks after the visit. So we're trying to take whatever preliminary information we can get, but again, the details are not all there at the pre-exit. So it's hard to make assumptions on what they're talking about, right? So just trying to pull what we're hearing from pre-exit, but then just, on the final reports too, and then trying to share that with you all. So we'll continue to do that. We're going to map out some of that in our unit. Adriana and Megan are working on pulling that stuff together. So we'll continue to share. And then I will set something up. I think maybe try to find something like 2.5 weeks out, make them a little closer together as we're getting more information. So that way, sharing it back out with you as quickly as possible to try to help. And I'll get you an answer to the assistant PM question, I promise. And then I'll look for some resources from that peer review to see if there was anything additional that we can pull from there for the interviews. Right. Well, thank you, everyone. I hope you have a good day. Stay cool. We will talk soon.